But when multiple modalities can target the same biology, whether they are ADCs, T-cell engagers, cell therapies, how should companies, meaning pharma, decide where to invest and what will differentiate success?
Well, I think when you have a target that you know will deliver clinical efficacy, it's often the case that companies will bring multiple modalities forward and explore, what the benefit risk is in different populations. In some instances, it's possible that one thing, may be
better,
hands down the best.
Yeah, clear
but in
winners.
other situations, you find that different patient populations benefit from a different modality. I mean, a very good example of this, I think, is in, the CAR-T, T-cell engager, and ADC space with myeloma, for example. I mean, here you have multiple modalities against BCMA.
All going after BCMA.
Yes,
Right.
But they all coexist. Cell therapies obviously can be a one-time, highly effective treatment. Even within the different cell therapies, there are subpopulations that benefit differentially depending on, the cytokine release syndrome risk, for example, versus the efficacy. T-cell engagers are highly effective, but they need repeat dosing. You may have patients where, the immune system is so dysfunctional that those types of therapies don't work very well. And, there an ADC might be the best solution. So these things tend to reveal themselves as you move through the early phases of development.
Thank you. That makes sense. So physicians may encounter a situation or perhaps the options of sequencing or using these in combination. Would you expect that?
Oh, absolutely. I mean, I think, we already see in clinical development, that a new modality against a target like BCMA, the patients that are enrolled often are patients who've failed one of the other modalities previously. So, you're rescuing the patients by cycling or sequencing the modalities. That's another way that having multiple approaches can be very important.
So especially for big pharma, given your response here, Rupert, it's very likely we'll see a situation where big pharma will want to have multiple modalities against the same target. Would you say that's true?
Yes, I think in many cases that's the case. I mean, if it's a very important drug target and a very significant unmet need, I think companies frequently like to be able to, cover the waterfront of treatment options for that patient population. I mean, that helps provide a much more complete set of treatments for the patients that you're targeting.
Great, that makes sense. Anything else you'd like to add just to close?
No, I think we've covered that well, Chris. Thank you.
Great. Thanks a lot, Rupert. Appreciate it.
Thank you.